A young nurse was taking care of an elderly woman in a wheelchair. One night at 2 a.m., she heard strange noises in the hallways. She fell to her knees when she saw this on the cameras. The fluorescent lights of Oakwood Senior Care Facility flickered with a subtle hum, casting long shadows across the polished linoleum floors. It was 7:15 p.m. when Sarah Mitchell adjusted her navy blue scrubs and completed her initial patient rounds. At 27, she had already developed the quiet confidence of a seasoned nurse, her brown hair pulled back in a neat ponytail, her hazel eyes missing nothing. Room 217 was Eleanor Thompson's domain, a space that seemed to breathe with a mixture of stillness and unspoken stories. The elderly woman sat motionless in her wheelchair, positioned near the large window that overlooked the facility's meticulously maintained garden. Her silver hair was carefully combed, not a single strand out of place. Her hands, thin and pale, rested on the wheelchair's armrests, fingers slightly curled, seemingly frozen in time. "How are you doing this evening, Mrs. Thompson?" Sarah's voice was soft, professional, but carried a genuine warmth that distinguished her from many of her colleagues. She had learned early in her nursing career that communication was more than just words. It was about connection. Eleanor's response was typical, a slight movement of her head, a barely perceptible blink. She had been at Oakwood for 3 years, and her medical records painted a clear picture of complete immobility. A severe stroke, combined with what doctors described as extensive neurological damage, had left her almost entirely dependent on round-the-clock care. As Sarah began checking Eleanor's vital signs, she noticed something peculiar. There was a spark in the old woman's eyes, something that didn't align with the medical reports. It wasn't just intelligence, it was something deeper. Defiance, perhaps, or a carefully guarded secret. The night shift at Oakwood was always a study in contrasts. The daytime bustle of nurses, doctors, and visiting family members gave way to a hushed, almost reverent atmosphere. Each room told a different story of human fragility and resilience. But Eleanor's room felt different. There was an energy, a tension that Sarah couldn't quite define. She completed her routine checks, temperature normal, blood pressure slightly on the lower side but within acceptable parameters. Eleanor's medical chart was a testament to her perceived condition: total paralysis on her right side, minimal cognitive response, complete dependence for all daily activities. Yet, something didn't feel right. Sarah remembered the first time she'd been assigned to Eleanor's care. Her supervisor, Margaret Reynolds, a tough, no-nonsense nurse with 40 years of experience, had briefed her specifically about this patient. "Eleanor Thompson is one of our most challenging cases," Margaret had said, her glasses perched on the edge of her nose. "Absolute care, round the clock. No expectations of improvement. Her family rarely visits, maybe once every few months. Tragic case, really." But Sarah had always believed that every patient had a story. And Eleanor's story seemed to be written in invisible ink, waiting to be deciphered. She adjusted Eleanor's blanket, noting the way the woman's muscles seemed to subtly tense, almost imperceptibly when touched. It was a microscopic reaction that most would miss. But Sarah was not most nurses. The evening progressed slowly. Other patients required attention: medication rounds, comfort measures, occasional late-night anxieties to soothe. But Sarah found herself repeatedly drawn back to room 217, watching Eleanor, sensing something brewing beneath the surface of this seemingly immobile existence. Outside, the autumn wind pressed against the windows, Leaves danced in intricate patterns, casting shadows that seemed to whisper secrets of their own. Eleanor continued to sit, her gaze fixed on something beyond the window, beyond the carefully manicured garden, beyond the walls of Oakwood. Something was different. Something was waiting to be revealed. Little did Sarah know that this night would be the beginning of a journey that would challenge everything she thought she knew about patient care, about human resilience, and about the stories that people choose to tell and those they choose to hide. The night settled over Oakwood Senior Care Facility like a heavy blanket, muffling the usual sounds of institutional life. It was 1:47 a.m. when the first unusual noise caught Sarah Mitchell's attention. A slight scraping sound, almost imperceptible, echoed through the quiet hallway. Sarah had been reviewing patient charts at the nurse's station, a half-empty cup of coffee growing cold beside her. The night shift always demanded vigilance, but tonight felt different. The fluorescent lights cast a sterile glow, creating sharp shadows that seemed to dance at the edges of her peripheral vision. She'd worked countless night shifts, understood the symphony of sounds that typically filled a care facility. The soft beeping of medical monitors, the occasional muffled cough, the distant hum of the industrial refrigerator in the medication room. But this sound was different, deliberate, controlled. At first, Sarah dismissed it. Exhaustion played tricks on the mind during these long, silent hours. She rechecked the security monitors, her fingers moving methodically across the multiple screens that displayed the facility's various corridors and patient rooms. Room 217 caught her eye. Eleanor Thompson's wheelchair stood exactly where it had been earlier, positioned near the window, bathed in the soft moonlight that filtered through the partially drawn curtains. But something was off. The angle seemed slightly different, almost imperceptibly so. Sarah leaned closer to the monitor, her heart beginning to race. The camera in the hallway outside Eleanor's room suddenly captured movement. Slow, calculated movement. A figure, unmistakably human, moving with a grace that contradicted every medical record, every diagnosis, every assumed limitation. It was Eleanor. Walking, not shuffling, not struggling. Walking with a purposeful stride that suggested years of practice in moving silently, carefully. Sarah's world tilted. Her coffee cup slipped from her hand, shattering on the floor, the sound lost in the magnitude of what she was witnessing. Eleanor Thompson, the woman diagnosed with complete right-side paralysis, the patient who had been deemed utterly dependent for 3 years, was walking down the hallway with remarkable ease. Her movement was fluid, almost elegant. She was heading towards the bathroom, her steps measured, controlled, absolutely deliberate. No wheelchair, no assistance, no limitations. The security camera captured every step. Every movement was a direct contradiction to the extensive medical documentation that Sarah had read countless times. The same documentation that described Eleanor as essentially immobile, requiring total care for even the most basic functions. Sarah's mind raced. Professional protocol warred with human curiosity. Should she report this? Confront Eleanor? Document the discrepancy? The implications were massive. Medical fraud, potential insurance complications, ethical dilemmas that could destroy careers. But something deeper stirred within her. This wasn't about bureaucracy or medical records. This was a human story. A story of survival, of hidden strength, of a narrative far more complex than any clinical assessment could capture. By the time Sarah reached the hallway, Eleanor had returned to her room. The wheelchair was perfectly positioned, Eleanor seated exactly as she had been before, looking for all the world like the immobile patient everyone believed her to be. Their eyes met. For a brief moment, something passed between them. Not guilt, not fear, but a profound understanding. A silent acknowledgement of a secret now shared. Sarah realized this was more than just a medical mystery. This was a declaration of something more, a statement of human resilience, of a spirit refusing to be defined by limitations imposed by others. The night continued its slow march. The facility returned to its usual hushed state. But everything had changed. Something was waiting to be understood, and Sarah Mitchell was going to uncover the truth. Sarah Mitchell's hands trembled slightly as she pulled Eleanor Thompson's file from the archives. The medical records room at Oakwood Senior Care Facility was a claustrophobic space, lined with metal shelves packed with decades of patient histories. Fluorescent lights hummed overhead, casting a harsh glare on the manila folders that held lifetimes of stories. She knew what she was doing bordered on a breach of professional ethics. Yet the image of Eleanor walking confidently down the hallway burned in her mind, a vivid contradiction to every documented medical assessment. Eleanor Margaret Thompson. Born September 12, 1940, in a small farmhouse just outside of Burlington, Vermont. The oldest of 3 children, raised during a time when family expectations were as rigid as the wooden chairs in their modest farmhouse kitchen. The initial medical records painted a familiar picture of stroke and decline. But Sarah was looking for something else. The story between the lines. The narrative hidden beneath clinical observations. It was a manila envelope tucked behind the standard medical documentation that caught her attention. Inside, she found a collection of old photographs and handwritten letters that would change everything. The first photograph showed a young Eleanor, maybe 25 years old, standing proudly in a nursing uniform. Her posture was straight, her eyes bright with ambition. This was not the fragile woman in the wheelchair, but a woman of strength and determination. Eleanor had been a nurse herself, working through the 1960s and early 1970s. She'd graduated from the University of Vermont's nursing program in 1963, at a time when few women pursued professional careers. Her initial medical records showed a decorated career, commendations, recommendations, a life of service. But the letters told a different story. The first was from her brother, Robert Thompson, dated 1975. The handwriting was sharp, accusatory. "You've always been too independent, always thinking you know better than everyone else. Mom and Dad sacrificed everything for this family, and you choose to work instead of getting married, instead of taking care of them when they needed you." Another letter, from her sister Margaret, was equally cutting. "A woman's place is with her family, not running around in hospitals, thinking she's something special. You'll regret this when no one is left to take care of you." Sarah realized she was uncovering a pattern of emotional manipulation that ran deep. Eleanor hadn't just been a nurse. She'd been a woman constantly fighting against familial expectations, battling a system that demanded she sacrifice her own dreams for her family's demands. The photographs that followed told a painful story. Eleanor at family gatherings, her smile never quite reaching her eyes. Holidays where she was present but clearly isolated. Family portraits where she stood slightly apart, her body language speaking volumes about her emotional distance. A letter from her mother, dated 1980, was particularly brutal. "If you continue to prioritize your career over your family, you'll die alone. No man wants a woman who thinks she's more important than her family's needs." These weren't just letters. They were weapons, carefully crafted to break her spirit. Sarah discovered that Eleanor had never married. She dedicated her life to nursing, working in various hospitals across Vermont and New Hampshire. Her career was distinguished, multiple commendations, recommendations that spoke of her exceptional care and dedication. But the family pressure never stopped. When her parents began to age, the letters became more frequent, more demanding. Eleanor was expected to quit her job, to become a full-time caregiver. Her siblings, who had married and started their own families, contributed nothing to their parents' care. The final blow came in 1995. Eleanor's mother suffered a severe stroke, and the family immediately turned to her. "You're a nurse," they said. "You know how to take care of people." For 15 years, Eleanor cared for her mother. Her own career was put on hold. Her dreams of advancement, of further specialization, were sacrificed. And when her mother finally passed away in 2010, her family's gratitude was minimal. No recognition of her sacrifice, just an expectation that she would continue to be available, to be the family's perpetual caregiver. But Eleanor had other plans. The medical records showed her own stroke diagnosis in 2020. But Sarah now understood it differently. This wasn't just a medical event. This was a calculated strategy. By presenting herself as completely disabled, Eleanor had found her escape. A retirement home became her sanctuary, away from a family that had never appreciated her, away from decades of emotional manipulation. Her apparent disability was her ultimate act of rebellion. Her wheelchair was not a prison, but a key to freedom. Sarah sat back, overwhelmed. She was no longer just a nurse. She had become a witness to a life of quiet, profound resistance. The fluorescent lights flickered. Outside, the first hints of dawn began to paint the sky. Eleanor's secret was safe. But now it was also understood. The morning light crept slowly across the linoleum floors of Oakwood Senior Care Facility, casting long shadows that seemed to hold the weight of unspoken stories. Sarah Mitchell stood by the window of room 217, her reflection overlapping with Eleanor Thompson's in the glass. Everything had changed, yet nothing appeared different. Eleanor sat in her wheelchair, her hands carefully positioned as they had been for years. To any casual observer, she was the same immobile patient documented in countless medical files. But Sarah knew the truth now, knew the intricate dance of survival that Eleanor had choreographed with remarkable precision. Margaret Reynolds, the facility's head nurse, approached with her usual clipboard and stern demeanor. "Mitchell," she called, her voice cutting through the morning quiet. "I need the Thompson patient's updated chart." Sarah's mind raced. She understood now that exposing Eleanor's carefully constructed protection would be an act of betrayal, not just of a patient, but of a woman who had fought her entire life for dignity and independence. "Everything is stable," Sarah responded, her voice carefully neutral. "No changes to report." But stability was an illusion. The truth was far more complex. Over the next weeks, Sarah began to build a different kind of support for Eleanor. Small interventions, subtle adjustments, conversations that went beyond routine medical care. She discovered that Eleanor had been a pediatric nurse for over 3 decades before her stroke. Her medical knowledge was extensive, her understanding of healthcare systems profound. The very skills she had used to care for others were now employed in protecting herself. Their conversations began carefully. Sarah would sit during her breaks, initially discussing mundane topics: the weather, the facility's garden, the changing seasons. Gradually, Eleanor began to reveal more. "My family," Eleanor said one afternoon, her voice soft but clear, "never understood that caring is a choice, not an obligation." She spoke of decades of emotional manipulation, of being the family's perpetual caregiver, of sacrificing her own dreams to meet everyone else's expectations. Her disability was her first truly selfish act, and she was unapologetic. Sarah became more than a nurse. She became an ally. When Eleanor's siblings attempted to visit, rare occurrences that were more about appearance than genuine care, Sarah ensured the interactions were carefully managed, professional, distant, protecting Eleanor's carefully constructed sanctuary. The facility's administration remained oblivious. Eleanor's medical records remained unchanged. Her wheelchair remained her chosen shield. But freedom took different forms. Sarah helped Eleanor reconnect with her professional passion. Through carefully arranged volunteer programs, Eleanor began mentoring young nursing students who visited the facility. Her medical knowledge, her decades of experience flowed freely. She was teaching again, but on her own terms. Her family never knew the extent of her capabilities. To them, she remained the helpless elderly relative, tucked away in a care facility. They visited occasionally, perfunctory interactions that confirmed their narrative of her complete dependence. They never saw her walking the hallways at night. They never understood her strategy of survival. They never recognized her strength. As months passed, a transformation occurred. Not in Eleanor's physical presentation, that remained carefully consistent, but in her spirit. She was no longer defined by her family's expectations. She had reclaimed her narrative. On Eleanor's 83rd birthday, Sarah brought a small chocolate cake to her room. No fanfare, no large gathering, just a quiet celebration of a life of resilience. "I chose my freedom," Eleanor said, a rare smile crossing her face. Not through grand gestures, but through quiet, persistent resistance. The wheelchair remained her most powerful statement, a symbol not of limitation, but of liberation. Outside, autumn leaves danced in the wind, another season of change, another moment of quiet triumph. Sarah understood now that care was never just about medical treatment. It was about seeing the entire person, their history, their struggles, their remarkable capacity for survival. Eleanor Thompson was not a patient. She was a revolution, quietly unfolding. One careful step at a time.